Okay, imagine this for a second. What if your doctor could see into the future of your health with way more accuracy? All by, well, by translating the secret language of data. Today we're going to look at a brand new AI tool called ClinicalStatAI that wants to do exactly that. Think of it as a translator, sitting between these mountains of medical stats and the doctors who need to make sense of them. Let's get into it.
So what's the big problem we're even trying to solve here? Well, modern medicine is just drowning in data. And hidden inside all of that data are life-saving predictions. But here's the catch. They're locked away. And why are they locked away? Because getting to them requires some serious expertise in statistical programming, coding. And that's a skill that most doctors on the front lines, for obvious reasons, just don't have.
And one of the most powerful ways to make these predictions is something called survival analysis. The easiest way to think about it is like a statistical crystal ball. It helps answer these huge questions like, what's the actual probability this patient is going to survive 5 years after their diagnosis? Or how well is this new treatment really working over the long haul? I mean, this is incredibly powerful stuff.
And this slide, this just captures the whole disconnect perfectly. On one side, you've got the biostatistician. They're fluent in code, they're writing the scripts, doing the heavy lifting. And on the other side, you have the clinician, the doctor, whose entire world is focused on the patient right in front of them. And sitting right between them is like a giant wall of code, completely separating the data's insights from the doctor who needs them most.
So how in the world do you tear down that wall? Well, that's where this new wave of what are called no-code tools comes in. And the one we're digging into today, ClinicalStatAI, was literally designed to solve this very problem.
The promise it makes is actually pretty simple, but it's also really profound. The whole idea is to put the power of that survival analysis, that crystal ball, directly into the hands of doctors, without them ever having to write a single line of code. It's all about making these insights easy to get to, and maybe even more importantly, easy to understand. And the new way of doing things? It's designed to be just ridiculously simple. A doctor just uploads their dataset. They pick the analysis they want from a menu, and boom, they get back a full AI-powered report. 1, 2, 3. That's it.
Now, here's the part that's just wow. The speed. For a pretty big data set, let's say up to 10,000 patient records, this entire process from uploading the file to getting a full interpreted report back takes less than 30 seconds. That's a job that could easily take a data scientist hours of coding to complete.
So how does this thing actually work? Because it's not just about being fast, it's about translation. Let's pop the hood and see what the core innovation really is.
So here's the key. This isn't some mysterious black box AI that's just spitting out answers. No. It uses the established, validated statistical models that have been the gold standard in medicine for decades. And then it has this powerful AI layer right on top to translate what all those numbers actually mean into plain, simple English.
So this is what a traditional report looks like. For anyone who's not a statistician, it's pretty much gibberish. You've got hazard ratios and p-values and all these numbers. I mean, the real question a doctor has is, okay, that's great, but what does a hazard ratio of 0.52 actually mean for the person sitting in my office?
And here it is. This is the magic. That AI layer takes that dense table of numbers and turns it into this, a clear, natural sentence. Patients on treatment A had a 48% lower risk of an adverse event. All of a sudden, that insight isn't just a number. It's immediate, it's understandable, and it's something you can act on.
And just to be super clear, the engine doing the math here is rock solid. It's built on a foundation of these really well-established models that are used everywhere in clinical research, like the Cox proportional hazards model. So the AI is playing the role of the interpreter, not the mathematician. But it gets even cooler. It's also interactive. So if a doctor is still a little fuzzy on a term, they can literally just ask the AI assistant, hey, what does this hazard ratio mean? It turns a boring static report into a real conversation with the data.
Okay, now for a quick reality check. This all sounds amazing, and it is, but it's also really important to be transparent about where this technology is right now in its development.
So, here's the crucial thing to know. ClinicalStatAI is, at this moment, a proof of concept. All the testing so far has been done using fake, synthetic data, or public data sets where all the patient info has been removed. It has not yet been tested on real-world, live patient data from an actual hospital. Now,
In those early tests, the performance of the AI translator was actually very, very strong. About 90% of the time, the summaries the AI generated were a fantastic match for summaries written by hand by actual clinical researchers. The other 10%, well, they were still correct, but they sometimes missed a bit of nuance or a little too general.
So here's the trade-off as it stands today. On the one hand, you've got this tool that is incredibly easy to use. It's super fast, and it's built to be secure. But on the other hand, it's still very much an early-stage idea. It absolutely needs to be tested on real clinical data and plugged into hospital systems before it can really live up to its full potential.
So, with all that in mind, what's the path forward? Where do we go from here? Let's take a quick look at the roadmap for turning this awesome concept into a clinical reality.
The roadmap is pretty clear and makes a lot of sense. The very next, most critical step is validation with real anonymous patient data from partner hospitals. After that, the plan is to add more models to its library, hook it up to live hospital systems, and of course, make sure it's fully compliant with all the big regulations like the EU AI Act.
And this really brings us right back to the original mission. At the end of the day, the goal isn't just to build some clever software. It's about bridging that gap that has existed for so long, the gap between the raw power of statistics and the critical need for understanding at a patient's bedside.
Which leaves us with a really fascinating question for the future of medicine, right? As tools like this get better and better, they stop being just calculators. They become interpreters. So the real question is, will AI become the doctor's most trusted translator, turning the complicated language of data into the clear, simple language of care?